Welcome to our talk today, our discussion about this really wonderful and exciting project and partnership that Amplio and ARM and VSO are working together on in Zambia. We'll be talking about the Talk project that is led by VSO Zambia, but you'll hear about kind of this unique partnership that these three organizations have come together on this project with. And of course, the focus of this project is sexual and reproductive health and rights, particularly with adolescents. This is a wonderful project working with youth groups to help discuss and share information about sexual and reproductive health and rights. So of course, we'll hear much more about that work during our discussion. But again, we're so happy to be hosting this today with you all, and thank you again for joining us. Just a quick note about the format of our discussion today. I will be posing some questions to our panelists. We'll do some question and answer led by me, the moderator. And then in the last part of this session, the last 20 minutes or so, we'll open it up to audience questions as well. And so please feel free to put your questions at any point during the discussion. You can type your question into the Q&A function that you'll see at the bottom of your screen. So please, you can also use the chat to drop in any comments you might have. But if you have a question for the panelists that you'd like to ask, please put that into the Q&A in that separate function. So let me go in and quickly introduce who we're talking to today. First, briefly, my name is Lindsay Dakin, and I am the Business Development Coordinator for Amplio. I've been with Amplio in Seattle here for just under a year. And before that, I was living and working in Uganda for about 4 years doing program management and evaluation there with a couple different women's economic empowerment and financial inclusion programs. So thrilled to be here and representing Amplio, but yeah, I'll be doing the moderator function. And then we also have Mavis Banda. She is the project officer managing the Talk program in Zambia. She's been managing that project for over 5 years, I believe. And she specializes in and is really passionate about, you'll see in the way that she speaks, about adolescent sexual and reproductive health and rights. But she also has experience advocating for women's and children's rights on other programs previous to joining VSO. She's got her BA in social work from the University of Zambia, and she's also a skilled and passionate trainer. So again, I think we'll see her passion and her heart that she brings to her work as we talk to her today. We also have Anna Mullen. She is running ARM's Amplio Community Engagement Program, Employee Community Engagement Program, Team ARM, it's called, which engages ARM employees to create positive change in communities and advance the United Nations Sustainable Development Goals. ARM is really, really special in their commitment to advancing those SDGs. And so hopefully we'll hear more about that from Anna in our discussion as well. Anna is particularly passionate about motivating young people, and particularly girls, to build their skills in STEM and to pursue STEM careers. And just also to say that ARM has been a longtime partner and supporter of Amplio. And so just want to thank Anna for joining us today, and thank ARM more broadly for their continued partnership. It's been a really wonderful partnership over the years. And finally, we have Rabia Abdul. She is Amplio's product manager, where she leads the development of Amplio's suite of products, mainly our software products. And prior to joining Amplio, she was also working with NeoGov and Avanade, a couple different tech companies, to lead their product development and business analytics. Rabia grew up in southern India and earned her bachelor's in computer science there before coming here to the US to earn her MBA in finance at Willamette University. So thank you so much to Rabia for well, bringing your talent to Amplio and also for joining us today. So with those introductions, I'm going to stop my screen share and just bring our videos back to you. I'm going to start off with our first question. I'm going to kick off our discussion. So Mavis, the first question is coming to you. Can you just tell us a little bit about the sexual and reproductive health context in Zambia, and what kind of challenges do you face there in terms of especially reaching adolescents with the sexual and reproductive health information they need to make healthy choices? And then also just tell us a little bit about the Talk project in general, what you're doing and working on.
Okay, very much. So happy to be participating in this webinar. I would like to share a slide as I go through a couple of questions that you have asked me. So in a moment, let me just pick. I have so many things that I opened. Okay, I seem to have found the slide. Okay. So I'd like to talk about, I'll talk about the Talk project and also as VSO, how we work and what we envision, why we work the way we work, just a bit of that. And then I also will talk about the Talk project and also the Zambian context in terms of sexual reproductive health and how we reach, or the challenges we encounter as we try to reach young people. First of all, I think I always like to give just something about this photo. It's a youth. This is some activity on the AMPU project. It's about a youth who is, standing out from a crowd and, just trying to impress that they are, and they, there's something they can do and they can stand out in a crowd. And I think that is the way I choose to look at young people. I also talk just briefly about VSO's theory of change, where we believe we bring people and to improve access to good quality and basic services, to encourage individuals to participate in change. We also strengthen civil societies to give people a voice, influence governments to implement policies that help the poor. Then we believe that we can end poverty. Okay, so the Talk project is in Luapula. That's where our project sites are. We particularly chose it for its remoteness and also as a continuation from the first Adolescent Talk project. So that's where we are based, but the country office is based. Regarding sexual reproductive health challenges, there are various, and I'm just mentioning some of them in these slides. So Zambia has relatively a young population. 45.4% of persons are aged below the age of 15, while those below the age of 18 are the majority of the population, 52.2%. What we can also appreciate is that adolescence is a period where young people are experiencing many changes which they may not understand, which where they have no one to explain to them. So these are the stages where they need key health messages, they need mentorship, they need someone to give them direction. So about 65% of adolescents aged 15 to 19 experience barriers in sexual reproductive health services. And it's a remote place that it's distant, the distances are very far, especially when it comes to accessing sexual reproductive health services. And these barriers are not only just the distance, it's also tradition and culture, where parents are not able to share, or it's taboo to share sexual reproductive health information with the children. So children are left to, listen to each other. There's also a lack of law enforcement structures, where in certain places, especially the islands, there are no, even mainland, some of the remote places, some of the very deep places have no law enforcement structures. So even when a crime is committed, people don't get to report. They will maybe get to report to the traditional leader, who will just charge the culprit or the offender with chickens, or and those in cases where even a rape has taken place or defilement has taken place, and yet people get away with just paying a chicken or a goat. So in rural areas, adolescent pregnancy is higher, 37% in urban areas, which is at 19%. And we're working in Samfya, which is a rural area. This is made worse by, the forced marriages, and also for worse even for unmarried adolescents. Sometimes pregnancy unintended or intended, because they are not only pregnancy control measures. Also do not have reliable information. Instead, when they fall pregnant, they opt to carry out an illegal abortion, which may end in death or in worse health conditions. Other barriers are, some of these health workers stay in the community with these young people, and they're friends to their parents. So there's very little privacy or confidentiality when it comes to accessing sexual reproductive health services, because young people are scared that they will be looked down upon, or they'll become a subject in the community if they access sexual reproductive health services from the health facility in their neighborhood. So this is just a photo of participating in World AIDS Day. Talking about the TALK project, we are targeting adolescents aged 10 to 19 years. And the project is supposed to be implemented for 12 months, but we started quite late. We started quite late. So we are actually we started in January, but then because of the advent of the COVID, we had to put certain activities on, resumed sometime in June. And the project is supposed to end in December. The project targets 1,000 adolescents and 8,000 family members in 5 wards of Samfya, which is Kapata, Chimana, Mano, Chishi, and Bawala Island. And information is disseminated through small groups, which are facilitated by our trained youth facilitators. This is also done every month. A group member is supposed to go to the talking book home to go and listen with the rest of the family or their household. We, as a project, aim to increase awareness and access to accurate sexual reproductive health. And also the talk to is utilizing the talking books technology, which are audio devices. You see in one of the slides, the visual of how it looks. With this strategy, it's got potential to reach a wider members of the community, or more people in the community, through youth volunteers, and work through Ministry of Health structures up to community level, from district to community level. Some of the things we do as a project is because we work in these rural areas and chiefs are very, very influential. So we prioritize engagement of chiefs or traditional leaders. This is one example at Chishi Island where we went to meet the chief, the senior chief there, and a very helpful individual. Some of these photos are showing some instances where, especially with the girl in the picture, when we first took the talking books, the joy she showed about the technology was now, this is the end to, it's goodbye to boredom in the village, just showing the excitement of having technology in their village and, just something that can engage young people away from bad vices. What do we expect to see after all this intervention and dissemination of accurate information is that we want to improve reach of messaging by, young people exposed to comprehensive sexual reproductive health messages in the school, but it's not validated or reinforced at home by their parents for many reasons, because the parents may not have information on sexual reproductive health, and also because of traditional inclinations. We also want to improve the quality and relevance and consistency of messaging, whereby when we put the message in the talking book, it's going to be delivered as it is, the way it was designed. There won't be any change to it because it's standard. So every individual that will be reached to talking book will be exposed to the very same message, thereby improving consistency also and the relevance of messages. We also want to improve engagement from direct, non-direct forms of message transfer. A lot of times, and I think I can share this, I'm just from a refresher of our facilitator. We're doing a refresher of facilitators training, and one of the participants expressed that, with the talking book, it's easy to talk about menstrual hygiene with your sisters because you won't need to be there when you're talking about menstrual hygiene. You just put the message hygiene and you leave your sisters to just listen to it and walk away. So I think those are some of the dynamics when it comes to culture and tradition and access to sexual reproductive health. And also because the talking books are also have a facility where you can record user feedback. We also get real-time data on the effects of the messages, how the participants have received, or if there are any gaps there, we get to listen to the feedback. And also another thing is that we also can have the data onto the Amplio system that we can use, especially to compare trends and things like that. And this is also one of the facilitators conducting a session on sexual reproductive health in Samfya. And I think the majority in this group were this is Mbabala Island from Lake Bangweulu, very beautiful view, and encouraging everyone. It's Samfya at least once in your lifetime, sorry. Okay, so also I took a photo of Samfya just so that beauty of Samfya, it's a very beautiful place. I took it at sunset, also a very nice place. And then also just demonstrate how remote and also impassable sometimes the roads become for us to reach these communities. This is one of the instances when it was flooded, the road became flooded, we couldn't pass with the vehicle, we had to walk a distance to just access a village. And these are typical village huts. I took it from a very far so that I don't take photos of people. One of the components of the talk too is that we also have deliberate inclusion of persons with disabilities. And some of our facilitators are actually persons with disability, as you can see in the picture here. And this is also one of the demonstrating how the talking book can be used in a group. This also, I can talk about the traditional leaders traditional dancers at an island when we're fishing and how they received us. You can see the joy dancing, you know, and accepting our presence there and the intervention we brought forth. So I think I did share on the challenges. Is there something I've left out, Lindsay?
No, Mavis, thank you so much. That was great background on this project. Yeah, you talked very well about the challenges and then how the talking book is helping you to address some of those challenges. So it's wonderful also to see some of these photos from the field and give us a sense of where you're working and what you're doing. So thanks for that. I know there's more that I want to ask, that I want to hear from you, Mavis, but let's move on to our next question, give our other couple panelists a chance to jump in. So Anna, I'm coming to you. Can you just talk a little bit about, so ARM introduced Amplio to VSO. ARM kind of helped make this partnership happen. And so can you just tell us a little bit about why you wanted to make this connection, why you thought the talking book could be a good fit for this project? And also if you want to just give us a little bit more about the community engagement that ARM does. It's so wonderful. So go ahead, Anna.
Absolutely, thank you. And thanks, Mavis. I loved seeing those pictures. So thank you so much for sharing. Before I answer the question, I thought it might just be worth actually explaining who ARM are, just in case anybody on the school hasn't come across us before. So we are a global technology company. I'm going to tell you our purpose, even though it does sound a little corporate, but we say that our purpose is to bring brilliant people together to unlock the power of technology and spark the world's potential. And in terms of how we actually do that, we provide the architecture for everything from wearable technology to autonomous vehicles. And one of my favorite facts about ARM is that actually back in 2014, 2015, at the point where the global goals for sustainable development were being agreed, ARM was asked whether we felt that technology should be the 18th global goal. I'm assuming knowledge here that everybody has heard of the SDGs, but if you haven't, I give you permission to go ahead and Google them while I'm speaking. So we were asked this question, should technology be the 18th global goal? And we said no. We said that technology is a means to an end, it's an enabler, and actually technology should underpin all other 17 global goals and help us to achieve those goals. That to me really sums up the role that we see ARM playing in terms of, you know, the sphere of creating positive change in communities. And our sustainability strategy is very much focused around creating purposeful technology to support the delivery of these global goals. So, you know, taking it beyond the self-driving cars and the IoT-enabled fridges, what we do is we work with partners who have an interest in creating social impact. And our goal there is to enable everybody to feel the benefits of technology in making lives safer, healthier, happier. And when I say everybody, I mean especially those 3 billion people who haven't really benefited from technology yet. So the talking book, which is based on ARM technology, is to me a really perfect example of this. And that kind of partnership model is very typical to the way we work, because, you know, ARM is very humble in recognizing that actually we're much stronger when we work in partnership. So as Lindsay acknowledged, we've been working with Amplio for, I think, almost a decade now. And a highlight has been a 3-way partnership that we worked in along with UNICEF, which resulted in, I think, over 100,000 people in Ghana getting access to vital health and agriculture information over the last few years. And when that program ended last year, the participants cited the talking book as a top source of information for all the topics covered, as any of you guys joining the call from Amplio will know. So it actually felt like, you know, a really obvious connection to bring VSO and Amplio together, and a great example actually of the organic connections that come about as a result of working in long-term partnership. And VSO's talk project, as Mavis has said, is centered around, you know, the need for information sharing. So the talking book is a really ideal tool for achieving this. And I do want to acknowledge here that we know from history that there are plenty of examples of technology being introduced for its own sake and the solution coming before the problem. But it was really clear here that actually connecting VSO and Amplio would be hopefully win-win. So now we're all working together to educate youth communities about sexual health and reproductive rights. And you know, clearly this work would have happened without the technology, but the talking book has been a major enabler and a major kind of factor in facilitating it and making it easier.
Fantastic, Anna. Thank you so much for that wonderful background on ARM and on our partnership. That's really helpful to hear. So, right, we've been talking about, you know, the talking book. So, Rabia, tell us, what is this thing? What is the talking book, and then the other sort of full suite of tech platforms that that Amplio is able to provide? Tell us a little bit more about how all this works.
Absolutely. Thank you so much, Lindsay. Well, I'm going to provide some information about the talking book. So we receive information through TV, through computers, through internet, through newspapers, books, etc. Right now, we are in a knowledge sharing session, but there are about 750 million people who are illiterate in the world. 1 billion women do not have access to cell phones. 800 million farmers live on less than $1.90 a day, and about 1.3 billion people live without electricity. How can they receive information to improve their lives? How can they break through these barriers? To answer these questions, Cliff Schmidt, our founder and chief executive officer, founded Amplio about more than 10 years ago with a mission to empower the world's most vulnerable communities through knowledge sharing. And thus the talking book was introduced to the world. The talking book is a rugged, easy to use, battery operated audio device, which is designed to be used by those with low literacy and zero literacy skills. It can deliver hours of on-demand content in any local language. It captures quantitative usage data, it records user feedback, and it is an equitable, neutral device that can be easily accessed by marginalized groups, youth, and women alike. Some of the features of the talking book are that it can store several hours of audio messaging and information. It runs on locally available batteries. It has a built-in speaker that allows families and groups to listen and learn together. It has a built-in microphone that allows users to record feedback. There are embossed icons, as you can see on the right side, for the visually impaired. It also has a USB port to connect and update data in the field. You can use the talking book with a variety of different listening models. Some of them are listed here. There is the household model, where the talking book is rotated between families or households within a community. There is the groups model, where the talking books are played at meetings of community groups such as village savings and loans associations, mothers groups, youth groups, etc. There is the community workers model, where the talking books are distributed to nurses, health volunteers, and other community workers to support their work. And the place-based model, where the talking books remain in a location that is accessible to the community, such as a classroom or a health center living room. Here are some of our partner organizations, and we also work with affiliate organizations like AMPU Ghana and Center for Behavior and Change Communication that develop local talking book programs and help amplify our impact. That's it for me.
Great, Rabia. Thank you so much for that background on Amplio and the talking book. I think we'll dive more in a little bit into some of the other products and new developments that we're working on right now. But Yeah, Mavis, I'm going to come back to you so we can hear a little bit more about, tell me about your experience and VSO's experience so far with setting up and running this talking book program. What's been really effective about it in the field, or maybe any challenges that you faced and how have you overcome? What are you seeing, once you've introduced the talking books into these communities? Madam, you're muted. We can't hear you.
I just realized that. Okay, I think the talking books journey has been highly engaging. I think Amplio and together with have been very helpful. We've had a relationship where our communication has been open. We have been doing a lot of consultation, I think within the three organizations, which has really been helpful also in setting up. And also in terms of the technical aspect of it, we had a training. I think all of us, the project team, had a training that on the use of the talking book. At first, it was really strange, and it looked very complicated. But I think we got the hang of it along the way, and now it's just we realize it's an easy to use technology. Very good for low literacy communities because it's audio. You don't need to read. You don't need to know how to read. It actually talks to you. So the navigation on where you need to go is in audio, and it's also in the local language. That's the content that we uploaded on the talking book. We had a few challenges, I think, from a few individuals who may not have understood on how to use, especially when it comes to recording. But what we have been doing is just following up with these community facilitators so that we give them support when that happens. But these are very isolated incidents. So far, so good. It works very well, and it's households where they completely nobody knows how to read are able to operate it and able to get the information from the talking book. The setup, really, the support has been fantastic from Amplio. The relationship has been so good so far. Where we are, I think it's a good place. Yeah. Not sure if that answers.
Absolutely, Mavis. Thank you. No, it's great to hear the reception. Sorry, my cat is visiting. It's great to hear the reception from the community with the talking books. Definitely, it's always exciting, to see this, a new technology being brought to some of these folks, especially youth that might not have had another chance to engage with other types of technology. So that's wonderful.
Anna, let me also just add.
Please.
Can I also add that, we've had in certain communities, they're actually demanding that we should, distribute more talking books. Traditional leaders, where we engage them on information sharing platforms, are actually saying that each traditional leader should have a talking book in their home, which is not possible. But, it's just demonstrating the excitement they have after receiving the talking books in their community.
That's wonderful to hear, Mavis. Yeah, we can dream, right? Someday, maybe. Anna, I'm going to come back to you. So can you tell us more about, I know that there's kind of an interesting volunteer aspect to this project that again, ARM and VSO have helped to facilitate. Can you tell us a little bit more about this volunteer project that we've been working on?
Yeah, absolutely. So where to start? I think something that's really core to ARM's culture is actually enabling our people to support our sustainability goals. And I can truly say that I work with some incredibly committed, sustainability-minded colleagues. So we have this rich culture of supporting the communities where we work through volunteering. And historically, that's more been the local communities where we work. I'm really enjoying your cat joining the webinar. I'm actually hoping mine might come along and join too in a minute. so last year we started exploring the creation of an opportunity to let people kind of develop and practice their professional skills whilst also volunteering for 1 to 2 weeks with some of our social impact partners, our sustainability partners. And again, the goal was that it would give them this first-hand experience of how ARM-based technology can support the global goals, but it would also mean that we could recruit people with very specific skill sets that were needed by the social impact partners. So trying to create something that was mutually beneficial. And then back prior to coronavirus, this was our original plan to go on these kind of physical field trips for 1 to 2 weeks and to give that kind of intensive support. And we were gonna take a team of 5 colleagues from different backgrounds at ARM to Zambia for 2 weeks to work with VSO and support with the training and the implementation of the talking book as part of the talk project. And what was amazing is that we had this overwhelming response for a call out for volunteers, and we were able to put together a very, very experienced, very diverse team of colleagues from the UK and the US with technical and non-technical backgrounds. So at ARM, we're 70% engineers, but we felt it was important that actually we had a real mix of skill sets in that team. And a priority was obviously making sure that their expertise was a good match for this project. But I would say that the thing that really made these 5 people stand out was their understanding of the potential technology has to make lives safer, happier, and healthier. And as you might have guessed, COVID did result in that trip being cancelled, but we wanted to make sure that actually the time and the passion that that team had committed didn't go to waste, and also, of course, that offer of support. So we're now preparing the team to run beta testing for a new model of the talking book. I won't say too much, but I can't wait to see the value that the team add. Interestingly, a couple of them actually do something very similar around usability testing of hardware professionally in their day jobs at ARM. One member of the team actually has directly applicable experience from something that he does in his spare time outside of work, which is really cool. And they've all been bringing quite a thoughtful lens in terms of the beta testing project to ensuring diversity of users when it comes to the hardware testing, and really thinking through the kind of real world ways in which this new version of the talking book will be used. And then the one other thing that I would add is that one of the advantages of what COVID has kind of created in terms of the way we've been forced to work is that it's given us the opportunity to bring in a couple of other colleagues from ARM to support VSO specifically. So we're currently getting 2 other colleagues at ARM up to speed on supporting projects around social media, data, and also graphics relating to the talk project. And I don't think that's something that would have happened if the world isn't the way it is right now. And it's really proven to us that there's a lot that we can do remotely from home, as well as kind of, you know, those opportunities when we're all able to be in person together physically.
Thanks, Anna. Yeah, I know having to cancel these field visits has been very disappointing for us all, but I'm so proud of the way that we've been able to adapt and change, you know, our plans to this context, and still, you know, the level of engagement and excitement that the volunteers have brought to this project has been really wonderful to see, and we really appreciate that. Yeah, I'm going to come back to you, Rabia. Can you tell us a little bit more? Right, so Anna just mentioned some of the testing that the volunteers are doing for us for our new products. Can you tell us a little bit more about this new version of the talking book and some of these other products that we've been working on, that we've been developing? I think you might be muted.
Absolutely. I'm going to talk a little bit about our new initiative called the Amplio Suite, which has been designed to bring all our products together in one place. The goal is to minimize the dependency of our customers on Amplio personnel to make our software easy to use and easy to scale. So with the Amplio Suite, we will continue to have some of our existing software, but we're also introducing some of these new features and tools like the introductory questionnaire, the program specification, the learning portal, the ability to easily download our software, and some changes to our analytics dashboard. So with the introductory questionnaire, we are going to ask some simple questions about the program to collect information about the program itself, like what languages the program is going to use for their content development, what country the program plans to operate in, what listening models do they plan to use, and other such questions. There will be additional context provided to help guide these responses, and these responses will be automatically updated in the program specification. The program specification is now modified to be a web form, which replaces the existing Excel spreadsheet. We will help walk users through the steps to set up their program, their content, to create playlists, to create different messages, etc. And we will also provide them the ability to submit this information to our other tool called the Audio Content Manager. Within the Amplio Suite, we also simplified the way that you can access our Amplio software, especially the audio content manager and the TV loader. It is now going to be a one-click download, and we will also provide links to our other supporting applications for download. Once you complete your introductory questionnaire and program specification, you can go into the audio content manager and load your content. All these audio files that you add will be sequenced into playlists for each topic in the Talking Book content called a package or deployment. And there will also be an input assistant that uses the program specification to walk users through setting up their audio files. The audio content manager adds metadata to each audio file, including topic, language, speaker, type of message, etc., which is very helpful in collecting usage data. Once content management is completed, you can connect to the Talking Book, and using the Talking Book Loader application, it is available on both desktop and Android mobile phones. We can load new content and automatically collect usage data and user feedback recordings at the same time. And this data can be sent to a cloud-based analytics dashboard the next time it connects to internet. We're also launching the new learning portal, where the learning portal is going to have a set of interactive lessons, job aids, activities to help our users learn more about Amplio's tools and products. This will be a self-paced training, so it will make it very easy for our users to be able to complete their trainings, go back, repeat trainings, and gain better knowledge and make them more confident in being able to use our products. We will also provide discussion forums to help further. We are also making some changes to the Amplio Suite. We are going to add Tableau visualization to track, aggregate, and monitor Talking Book usage data. You can monitor, evaluate, and improve your programs. And it also helps identify trends across communities, districts, and regions over time. And finally, our Talking Book version 2. With the Talking Book version 2, we have an improved speaker that provides better audio clarity. It runs on rechargeable batteries, which is a big deal for us. So it'll help us eliminate the waste that we used to encounter before. It supports USB charging, and it also supports the ability to support encryption of user feedback. And it allows the opportunity to make improvements like adding autoplay, etc., going forward. And we don't have a name for our Talking Book version 2 device yet, so please feel free to send us some suggestions. That's it.
Thank you, Rabia. That's all really, really exciting. I know a lot of these changes, these new products have been a long time in the works, and we're so thrilled to be launching them and rolling them out over the next few months. And again, so the team of volunteers from ARM will be helping us to test, kind of beta test, if that's the term, the tech term, to try out, kind of be our guinea pigs with some of these new products. So that's super exciting. Great. So just a quick reminder for the audience to drop any questions that you might have for any of our panelists into either the Q&A or even just the chat. If you have anything that you want to ask them. We've got about 10 minutes or so left in the session, and we want to open it up to you all at this point. But I have one more question that I want to throw to Mavis. We've talked a little bit about, of course, the effects of COVID on the volunteer project and some of the things that we've had to adapt to this year. But Mavis, can you tell us a little bit more about how COVID has impacted your work and the situation on the ground, and how have you adapted your programs? And then maybe how do you see things moving into next year and into the future? You know, what kind of adaptations maybe are we still going to need to make?
Okay, so I think I also talk a little bit about how these talking books have been very convenient and also appropriate in this COVID environment. Because a talking book doesn't require that the person needs to be there in terms of it being utilized at household level, we have given our facilitators, our youth facilitators, some sanitizer so that they can clean the talking book when it leaves their households, and so that we are not the point of transmission of the COVID. That's how appropriate it's been. And also we've observed in the groups, they make sure that the participants are in between 10 and 11 participants, who also sit 1 meter apart, just to, so that we just observe the given by Ministry of Health to reduce disease transmission. Let me also just talk about the technology and why the talking books, apart from just using them in this COVID environment, is that most young people are very much interested in technology. It's very popular among young people, whether it's in the rural areas or it's in the urban areas, or whether it's among literate communities, but young people or youth are really drawn to technology. And if you want to engage them, you meet them at that level. And that's how it's with the advances in artificial intelligence, and it's also knowing that young people, this is their source of information gathering, also interaction amongst themselves, and also connecting with other young people. The talking book, like I said, it's user-friendly. It doesn't need so much technical know-how. So it's easy for these communities that we are targeting to use. And another thing is that it's got potential to reach a wider audience or wider coverage, because of the simplicity in which it can go from household to household. Also, I think also opportunity for people working in the sexual reproductive health sector, where the data has not been consistent. It is also an opportunity for us to collect consistent information or data on sexual reproductive health around adolescents. In terms of going forward, I would encourage, for now, I don't think we're in a position to say we'll continue for so long and whatnot, but for me, this is one technology I would not hesitate to it's worked in the communities where we are working, and it's helped young people find a safe space where they can get accurate information without judgment. And yeah, I saw a question on in the chat box about if the talking book is going in households and it's making people uncomfortable, is it valuable? I say it is. This is a better time for us to, break or diffuse those cultural barriers, or traditional barriers that hinder young people from accessing accurate information. It's a human right, and young people need to have access to accurate information on sexual reproductive health. There's never a better time. Yeah.
Of course, thanks, Mavis. There's another question in the Q&A that we got that's kind of related to that note you ended on. Can you tell us a little bit more about the content itself, what kind of messages are on the talking book, and how did you produce those messages?
We engaged a consultant. The material that we used on the talking book is actually adapted from the National Reproductive Health Training Manual. So it's something that is from government approved materials, I should say. So, and then what we actually did, so we had to make sure that it was culturally appropriate, but there are certain messages that you can't avoid mentioning, issues to do with the use of condoms, the processes that young people pass through. Things to us in our tradition is taboo. You can't talk about them. So that's what makes parents uncomfortable sometimes. So it's also an opportunity for parents. We also engage them in meetings so that we can start diffusing all these barriers and making sure that they don't view messages as in that manner. Because even in our own languages, there's a saying that if you want to teach a child, don't leave anything out. So even when we have such sayings, our practice is quite different. So I think we should walk the talk and not. Thanks.
Thanks, Mavis. Thanks for that. There's one more question. I think we have time to do one more. And this is a really nice one to end on as well. Again, for you, Mavis, we all want to hear from you. But can you talk any more about the impact that you're seeing? What kind of impact is the talking book having on individuals or the community at large? And maybe is there any story or anecdote that you can share with us about what kind of changes we're seeing from the talking book?
Okay, so since we distributed the talking book, we've noted a lot of change in terms of engagement of young people. Where there's no recreation, like in the rural areas, usually this is, Samfya is predominantly a fishing community. So most of the adults would be in the fishing camp, leave children by themselves, young people by themselves. They also left to do their own vices. So we've reached young people come together as a group to listen to a standard message on sexual reproductive health. So not are they exposed to accurate information in their groups, but they also have a recreation that they can look forward to every week. So, which is very, very important. We are all aware that when young people have too much time on their hands, a lot of vices happen. So we've seen that happen. We've also seen changes in terms of parents accepting that, allowing the young people to belong to these groups, even when they have these traditional beliefs and norms where they will feel, no, these messages will be offensive, or you're actually teaching our children to have sex, because that is a very common accusation in the community, especially when you talk about condom. Yeah, so they've become accepting of these messages in their communities. They actually now realize that young people didn't have the platforms. Now they have the platforms. We've also had young people that were drinking, because some of the sessions is on alcohol and drug abuse, who have stopped and are now active facilitators of messages to their peers, which is a great thing. So far, I think those are some of the changes that we are beginning to see already.
Thank you so much, Mavis. That's also wonderful to hear, right? Some of these impacts that we're seeing from the field. Wonderful. Well, I think the last question that I'm seeing in the chat, which leads us nicely into our closing, is whether the recording will be made available. Yes, we recorded this webinar session, and we will be sharing that recording out for folks that weren't able to attend our wonderful discussion today. So thank you so much again to all of our panelists. This has been, I think a really rich and great discussion for us, just to talk about this great project that we're all working on, and write some of the impacts that the talking books can have. So just wanted to do a quick shout out that if you want to learn more about the work that VSO is doing, they do many projects all over the world, wonderful projects just like this one. And I know we have some other VSO friends on the call today as well. So thank you all for attending and welcome. We hope that we can continue to partner with VSO on the wonderful work that you're doing. So visit their website, check out what else VSO is working on. And then if you want to talk to Amplio more about the talking books, how they work, what the possibilities are for your program, and also to even get a demo device. We do have complimentary demo devices available if you want to check it out for yourself and see it in person. So get in touch with us at info@amplio.org, and we'll be happy to speak with you further about what the possibilities are. So thank you all once again for joining. Thanks to the panelists for such a great discussion, and we'll be in touch. Have a great rest of your day or evening in some cases, wherever you are.